This is Dr. Ko. I'd like to take the next few minutes to talk about two slides. This is our two-slide series. This patient came to me because we were looking at a worsening recession. As you can probably tell from this picture, that there is quite a bit of root exposure, and then a lot of times, along with root exposure, there tend to be a easier accumulation of plaque around the gum, and sometimes will result into some gum disease. Sometimes will result into gingival inflammation or bleeding. What we're trying to set out to improve for her is to actually increase the thickness of gum tissue. There are two types of gum tissue that we're looking at here in this picture. The line is actually quite nicely demarcated right here by my cursor, and right above it is what we called non-attached gingiva. Basically, this tissue moves around. We call these mucosa. So the tissue itself does not bound to bone, and when you pull your lip around, the tissue moves around. Right underneath is what we call attached gingiva. So these are the tightly buttoned gum tissue that basically prevents plaque from going underneath. So think of this as a really strong cuff that does the prevention. When the mucosa moves around, this is really the counterforce. So whenever there's not enough thickness here, the gum tissue really gets pulled up or down, depending on which jaw you're talking about. But in this case, the tissue is pulling up, and the thin tissue now is getting pulled up further away from the enamel, and then the roots are now getting exposed. So in this particular case, the patient is, one is having trouble keeping it clean. Second is suffering from some kind of sensitivity especially to cold. So we take the tissue from the palate and transport it to wherever it needs more tissue, and this is really the result. So going back and forth here, I think this is 4 weeks after we did the procedure. The recession seems to be better on both teeth. The thickness of tissue now really probably went from maybe 1 or 2 millimeters to now about 7. So this healthy tissue is going to prevent the tissue from sliding out further. Unfortunately, it does not cover the roots completely, but you do get about 1 millimeter of rebound effect. So the recession actually appears to be better. All right, so that's basically gingival graft in a nutshell. And this particular procedure is called free gingival graft. If you have any questions, please feel free to give us a call at our office, 508-478-3800. Till next time.